Hello, hello, hello. Today I am here with Dr. Shayla Toombs-Withers, and we are talking all about health. You are going to want to get in on this conversation. This is going to be so much fun. For those of you that don't know me, my name is Sabrina Victoria. I am the host here at Her Talk Show. If you have not already subscribed, girl, hit that subscribe button. What you waiting for? These podcasts are guaranteed to have you thinking differently about life and business. Let's jump right in.
Get ready, because today's guest is about to change the way you view your world. This is Her Talk Show, hosted by Sabrina Victoria.
All right. If you are listening live, welcome. And if you're listening on the replay, make sure you hashtag replay wherever you're at so we can send you some love in the comments. Listen, we've had over 600 women grace this stage. We are adding another one to the list today. Having practiced a plant-based diet for numerous years, Dr. Shayla Toombs-Withers incorporates her lifestyle into educating others how to improve and overcome their chronic diseases as a family and obesity medicine physician and metabolic health coach. She founded Essence of Health Wellness Clinic, I love that, and coaching in Chattanooga, Tennessee, to help individuals heal their bodies and improve their health using her signature mind-body balance approach. Her bases for health are in line with two of her favorite quotes: an ounce of prevention is worth a pound of cure. Yes. And let food be thy medicine. I love it. Welcome, lady.
Thank you so much, Sabrina Victoria. I am excited to be on your show and to chat with you today.
Yes. Thank you so much for being here and taking some time out of your day. I so appreciate it. I know we can get busy, but it's so important to sit down every once in a while and talk to the audience. Let them know
Yeah.
all of the things, let them dive into your world in order to open up their eyes. A lot of times we just don't know what we don't know.
Right. Yeah, for sure. And more and more we're seeing stuff in the media with folks with health conditions and health concerns that affects all of us. So it's definitely, a topic that definitely important for all of us. So
Yeah, so I know you talk a lot about plant-based medicine. Is that predominantly where your focus is?
yeah, so not necessarily plant-based medicine in terms of what some people may think of like herbs and supplements, but more so incorporating plant-based actual nutrition and using food as medicine. So using our nutrition and aligning that to prevent and reverse chronic health conditions, and many of those common conditions that probably everyone, either ourselves or our family members, have. So high blood pressure, diabetes, heart disease, kidney problems, skin conditions, mental health conditions. There are just so many things that plant-based nutrition can be helpful for. And so I seek to help people align that within their health.
When did you go plant-based? Is this a lifelong thing or did it get introduced to you?
Definitely not. Yeah, yeah. So I'm a girl from the South. So I grew up eating grandma's mac and cheese, extra cheesy, extra delicious. So no, it's definitely not a lifelong thing. But for me, I went plant-based after just suffering several years from some gastrointestinal health conditions myself, where I would just be doubled over in pain every time that I ate. I went and saw, it got to a point where it was just so debilitating. So I went to see my own doctor and had a full workup. They did all the tests, all the imaging, all the things. Thankfully, nothing significant was wrong. But then when I saw my doctor, he mentioned one, by me being African American, he said, lactose intolerance is highly predominant within African Americans, people of color. And so it could just be that you're just significantly lactose intolerant, which was something, that I found. Like I said, I love mac and cheese. So it was like, what? But he had me try an elimination diet where we eliminated dairy from my diet, even just for a few weeks. And it made just a tremendous improvement in the way that I felt. I could, go about my day and not have to worry about when, the stomach pain would kick in, or if I would, need to be close to a bathroom or those kind of things. And I just, even felt more energized and felt just so much overall better with just cutting that dairy out of my diet. And so that propelled me to even go more so for to like reading and studying and like learning just what is food doing to us as a people, and how are there other things that I hadn't known. And so I just start deep diving and reading and learning more. This was prior to me even going to medical school. So then once I got into medical school and seeing how health conditions and things play a part into this. And so that's just really what propelled me down that road until I started becoming just full on plant based, and really just noticing how much better I felt and did with my own health. And so I just couldn't stop talking about it to help my patients and help other individuals see results in their health conditions.
Beautiful. I'm really curious, not only for myself, but also for our audience here, on the conversations that you had to start having with friends and family who are used to you eating a certain way, and then all of a
Mhm.
sudden not, and then the little corkscrew that ends up kind of disrupting everything. How did
Mhm.
you manage, deal, have conversations around this new mindset?
Yeah, yeah, that's a great question because it's a thing. I remember the first time I started cutting out the dairy, and when you really don't notice it until you start cutting things out, that things are kind of almost everywhere. So it was like, well, what do I eat now? And so I remember talking to my mom and my parents. We were going to get food, and I was like, well, I'm not eating any of that. And they're like, well, why aren't you eating? So, I told them what was going on and how I was feeling better since avoiding it. And so then, it even gets to this drawn out thing that people are like, well, you can't eat anything. Well, that's not true. It's just that it takes a little bit more diligence and a little bit more knowledge to kind of figure out those things that you can have and those things that are more helpful and make you feel better. But originally, having those discussions with people, it brings about a lot of questions. So, people think, well, are you going to be malnourished? Where do you get your protein? That's a huge one that people are concerned about, and are you going to just kind of fade away and, be the sickly kind of thing, which none of that has occurred. No, that's true. But, people do that. It tends to bring about a lot of questions.
It's cool. Um, I'd love to have a conversation around doctors.
Hmm.
I know that's something that you really touch on a lot, and the multiple health conditions that can be prevented or even reversed. I know you talk about with the plant-based diet, and the difference between what a doctor, prescribing all this medicine and the medicines for the medicines because of
Yeah,
the
that
I'd
happens.
love to just kind of deep dive on that, and then we'll kind of go from, pick and choose from there.
Mhm. Yeah, yeah. So yeah, for sure. And so what, I've been practicing now for about 13 years. And so over the years that's led me to, a number of different type of practice settings, anything from working within the hospital to urgent care settings to just traditional outpatient medicine. And a lot of that, I found was that one, we never had enough time. So, even for patients, you commonly, hear people say, well, you're only, here 5 minutes and I didn't get to tell you about this, 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 and this. And, that's really bothering me, which is true because it's just crazy the way that the system is set up. But what tends to happen because of that is that people aren't typically told by their doctors is that they can you make some nutritional changes and some changes within, like when you introduced me in mind body balance, which is actually touching into our mental health and our mindset. Along with movement and strategies to get that movement into place. And so those changes can actually make a huge impact on several of these common chronic conditions beyond medication therapy. Medication certainly has its place. I do prescribe medicines. I'm a medical doctor, so I can, write you a prescription. But there are so many other ways that we can do things to one where you may not need a medication at all, or you may be able to take much less of that medication by putting some of these other things into place. And so, a lot of times it's just that your doctor either doesn't know, because I mean, it does happen where folks just haven't studied nutrition, or your doctor just may have not had the time in their practice setting to be able to go through these things and work through these things with you, to be able to lay it out for you in a way that can be helpful for you, for your condition. And so, you ask about what particular conditions. And so it's things, one I call the health crisis trifecta, because these are the most common chronic health conditions in America, which are high blood pressure, diabetes, and heart disease. So including those conditions of high cholesterol. And all of these conditions can be prevented and reversed with a plant-based focus in your diet, along with healthful movement and having your mental health, sleep strategy, stress management, those things under control. They can all be managed that way. But there are also some other things that people don't know about. One, for instance, chronic kidney disease. Chronic kidney disease is very prevalent in our country, and it relates back to those same conditions. Diabetes and high blood pressure are the most common causes of it. So when we fix those things, we can also fix our kidneys in that manner. And using these same strategies. Certain forms of cancer, even breast cancer, prostate cancer, colon cancer. These have all been shown to be helped and improved with the plant-focused diet. One thing that I like to point out is, because a lot of people just aren't aware, is that actually the World Health Organization deemed meat products, particularly hot dogs, bacon, which is, everybody loves their bacon, as carcinogens, cancer-causing foods. Yeah. And so a lot of people aren't aware that, you really shouldn't be consuming these things, because they can actually be promoting disease instead of helping you to not have to be challenged by these health conditions.
Yeah, 100%. So I'm in agreement with everything you're saying. However, I have met individuals along my journey who have said things like, my situation's different. Mine is hereditary.
Mhm.
I've had mine for so long, there's no way. So, what is the conversation around those individuals who just seem to have a wall or seem to be
Mhm.
stuck in the identity of?
Yeah, yeah. And so, there are some things that are hereditary. So I don't discount that. But some things seem hereditary, because you might say, yeah, grandma had this and my mom had this. Well, it's because everybody ate the same way. Everybody, had the same lifestyle, particularly when it comes to type 2 diabetes, which is not the autoimmune form, but the form that develops more in adulthood over time. We typically to more so see that in families, because most families kind of eat the same way, and have the same lifestyle. So it's not so much that it's hereditary, in a sense that, yeah, you got, for example, gene G that gave you this, and now you've got it. But it might just seem that way because a lot of people in your family have it, but because a lot of people in your family have also done things this way. But then there are some other things that can be hereditary. So, those autoimmune conditions, for sure, they can be hereditary. And so in those instances, if it is something that's truly hereditary, there are still ways that changing your diet, getting that intentional movement, getting your mental health into a stable place, can still lessen the impact, even of those type of conditions. I'll give you the example, even with type 1 diabetes, which is the autoimmune type, that a lot of people tend to get in childhood. And, it doesn't matter really what you eat. There's no like to say that, I ate donuts and now I have type 1 diabetes. It doesn't work that way. With
Wow.
type 1 diabetes, they just don't make insulin. But even in type 1 diabetes, studies have shown that those folks who consume a plant-based diet are still better able to control their blood sugar. So even though they still have to use insulin, because they absolutely don't make any insulin in that condition, but they're able to use less dosages of it than what may typically be needed, because they are incorporating more of a plant based diet into their lives that way. So, you know, so I say to those people that, yeah, you should still be doing this too. It's not just saying that, you know, well, this is just what it's going to be and that's it, because that's not.
Since we're on the topic of diabetes, do you I'd love for you to kind of just briefly, in a sentence or two, explain them all. Because myself, and I'm certain I'm not the only one, who doesn't really know the difference.
Right. Yeah, yeah. Yep. So type 1 diabetes is the one that is typically autoimmune cause, meaning that the body just doesn't make insulin. Insulin is what's needed. Let me even back up further. So with diabetes, what happens is when we eat or just naturally, you know, our blood sugar will rise. So say, for example, an apple. You eat an apple, your blood sugar will rise because you've had some food, some calories in. And so what tends to happen naturally is then you naturally make the hormone insulin, and the insulin comes in to bring your blood sugar back down to a nice, steady, and balanced state. Our body is designed and likes to be steady and balanced. And so that's what insulin does. Well, in type 1 diabetes, these individuals don't make insulin. So they don't have anything. So they eat that apple and that sugar just stays up. And so it causes problems that they don't have anything to help it go down. So in those cases, they do, even as, you know, young as um, little children would have to be on insulin in those situations, because if our blood sugars stay up too high, it can actually be damaging to several of our organs in our body, and can be significantly impactful. So you do have to take insulin. So that's type 1. Now type 2 diabetes is the one that's caused by insulin resistance. And so what happens with this one is that you do make insulin. So typically your body, you eat that apple, like I say, blood sugar goes up, and typically your insulin naturally that you make would be able to take it down. But what happens over time with this condition is that because your insulin has been used so much, it tends to just not work as well anymore. So the more times you know, consume things, typically say, you know, your sugar was here, your insulin's going to bring it down to here. Well, now I may only be able to bring it down to there because it's just not working as well. So you're tending to get higher and higher blood sugar. So that's when you tend to, you know, hear people say, well, my blood sugar was up, kind of thing, because your insulin has become resistant. So it's not working as well. That develops typically from lifestyle issues. So weight gain, diets that are high in processed carbohydrates, diets that are high in saturated fat will tend to promote this type 2 diabetes. And so that's the one that really can be impacted with our, you know, our dietary changes, our lifestyle changes in terms of that. Does that make sense?
Yeah,
Okay.
100%.
Right.
Definitely. So that's what they mean by I have the one that can't be fixed, or I have the one that can be fixed. That's why
Right.
they're saying
Yep.
that because
Yep. Exactly. Yeah.
okay.
hmm
Yeah, I didn't even
Yeah. Because
realize that.
type 1
I
people
literally
will still need insulin regardless. They're going to need it for life.
okay.
Yeah.
Wow, this is why I love podcasting so much because me, all transparency, had I didn't know which was which, but had like judgment on the individuals that now I know is diabetes 1 because in my head, I was like, they messed themselves up so bad that it's unfixable. I didn't know
Mm,
that it
yeah.
was
Yeah, and
just
I
their
will
body.
say insulin is used in type 2, the one that develops over time. It is used in those cases too, but what's typically happened is that because they have become so insulin resistant over time, because things, you know, haven't been put into place to improve this condition, then their bodies just can't with the insulin that they make, their body is just doing nothing at that point. So then
Wow.
they do have to inject insulin.
Is individuals that claim to or do have, hyperglycemia, is that intertwined in this too, the
Mhm.
sugars?
Yep.
How is
Yeah,
that?
so Yeah, that's a great question. And so there's also what we call pre-diabetes. And so that's more so your people who will have hyperglycemia, meaning high blood sugar levels, but they don't necessarily have the diagnosis or to meet the cutoff level the way we diagnose it of diabetes. So they're in the pre-diabetes range. But with pre-diabetes, it's an early sign that you're already starting to develop that insulin resistance. So your insulin's already not working that great, not optimal, which is why your blood sugars are starting to bump up higher and be higher than they should be. But it's just not at that level of full diabetes. But studies show in the science literature that you have a 50% chance of developing type 2 diabetes over 10 years if you do have prediabetes. So prediabetes is actually the perfect time to really, take it very seriously and say, okay, I'm going to do things differently here and get it under control.
Wow, so interesting. Yeah, I actually started to I don't know if I was hyperglycemic or not, but I would get, like, mad if I hadn't eaten, like
Mm,
I can't even speak
mhm.
because all I can do is think about food. Like, I will not say anything to you. I can't think about
Mhm.
anything or do anything until I get food. And that's more so, like, self-induced because if I do say something, it's not gonna be nice. So my whole
Gotcha.
life I had some
Snickers.
really bad yeah,
Yeah.
I had some really bad
Yeah.
repercussions with just, like, lashing out, and I just learned as I've gotten older to just not say anything because nothing I say is gonna be nice, but what I did
Mhm.
is I started fasting
Mm.
and started to really control and take my power back, I guess,
Mhm.
over my food intake. And I did some really drastic fasting probably last year, and now I've kind of set into a more of a rhythm of,
Mhm.
longer amounts of time without food, and it has helped
Right.
so tremendously. Like almost
Mhm.
it's gone almost with
Yeah.
my ups and downs of my sugar.
Mhm. Yeah, and fasting is one way that can be helpful for some people because, like you said, it can help to kind of reel in some of that constant thought of, oh,
Yeah.
I'm hungry, or you may not even be hungry, but that constant food noise. And so fasting can help to reel that in. Fasting can help to stabilize blood sugars for some people because it's by you only eating in that certain time frame, your body's not kind of bouncing around with sugar high and jumping up and down all day long because you're eating at different sporadic times of the day versus concentrating it in and balancing it. So yeah, fasting can
Yeah.
be helpful.
There was a huge change in everything, and one of the biggest eye openers that I had is just how much people think about food, or I think about food. It's like I'm sitting working, and then I'm thinking about eating, but I'm like, "I don't wanna eat right now because 'cause I'm working," but I'm still thinking about it. Then I'm like, "Well, what's over there? What's in the pantry? What's in the refrigerator? What could I possibly make?" All that time. Then
Mhm.
finally, I'm really hungry, so I go and then I look, and all the time to look and then prepare and then figure it out and then cook it and then the dishes and then the 3 times a day. It's
Mhm.
like
Yeah.
half the day is just spent either
Right.
thinking about food, making the food, cleaning the food, or eating. Oh my
Yeah, yeah.
god.
And a couple of things with that. I'm glad you brought that out because sometimes, we'll be thinking about food, but one of the things with individuals who I actually coach with health coaching is we talk about, well, what's the other side of that? So what's really going on, at those times where you feel like you're thinking about food? Is it because you're actually bored? Is it because you're tired? Is it because, you're feeling stressed because you might have, had a whole lot going on that day? And so, looking at those other maybe contributors or factors that maybe playing a part into that to where then it just leads your mind into planning that next meal. So looking at those factors. And then the other coin to that is that, that is a real thing for some individuals. And that's where a lot of the newer weight loss medications, have come into play too, because they've helped people to, I had a client tell me it's quieted that food noise that was just always in their brain too, with some of the weight loss medication. So it's two
Wow.
coins to it, but yeah, that's definitely a real thing. People
Very, very
experience.
cool.
Mhm.
And thank you for this. I've been taking a ton of notes. You're absolutely amazing. Just
Thank you.
a shout out to those that are watching live right now. We have quite a few people hanging out with us live. Thank you so much for being here, hanging out. Feel free to ask any questions that you have. I'd love to, since we're still kind of on the realm of talking about diabetes, I know that you talk about carbohydrates
Mhm.
with diabetes.
Yeah.
Explain that.
Yeah, yeah, that's one of my favorite things to tell people that yes, you can have carbs. As crazy
Wow.
as that sounds, because what tends to happen, kind of the old school thought process, and this even occurred in medicine, where we would tell people, no, you shouldn't eat carbs, you shouldn't eat fruit, you shouldn't, have all of these things, but it's not so much the carbohydrate. We need carbohydrates in our system. So there are things that are macronutrients. People, even within certain diets, people count their macros. And so those macronutrients are carbohydrates, proteins, and fats. And the reason that those are so important because those are the basis of our nutrition. And so all of those things we do absolutely need to have in our diet to be healthful because those provide the bulk of our nourishment in carbohydrates, proteins, and fat. But with carbohydrates, it depends on the type of carbohydrates that you're consuming. So if you're consuming those processed things, so which may be like your bread, especially just your regular old white or wheat bread, that's pretty processed. Anything like a potato chip or anything that's with flour, things that have had flour added to them, those things will tend to spike blood sugar. Biscuits, dessert scones, brownies, cookies, that kind of stuff. Those things will tend to spike blood sugar a lot versus if people consume more unprocessed carbohydrates. So what that would look like is beans. It would look like fruit. So particularly like your fruits with the skin on them, those fruits are actually high in fiber and actually very good for you, including for your blood sugar. And that would also look like whole grains in terms of like brown rice, barley, farro, oatmeal, oats, those types of foods. And so those types of carbohydrates are healthful for insulin resistance conditions as well as for weight management. The reason for that is because those foods are more slowly digested. When we talked about with diabetes, when you consume something, your blood sugar goes up and then that insulin has to come in to bring it back down. Versus with these unprocessed or very low processed carbohydrates, they don't tend to spike our blood sugar very high. They may spike it a little bit, but then it's going to kind of stay longer in your system and it'll stay more at a steady state because of the fiber in those products. And so that's why even those fruits with the skin on it are very important. So the apples, pears, blueberries, those types of things because of the fiber content. And that's what's helpful in those carbohydrates that we consume.
What is I'm thinking of like Ezekiel bread. Is bread
Mhm.
always kind of not good, or are there some breads like Ezekiel bread that are
Right. Yeah. So there are some that can be good for you. So Ezekiel is one of them. And the reason why Ezekiel is made from sprouted grain. So even if you kind of, even if you didn't know what a sprouted grain was, but you just looked at the difference of the bread, like that Ezekiel bread, it's going to have a different texture. It tends to be kind of, that really firm and you can even like
Yes.
see the grains in the bread
Yeah.
versus like your white bread on the loaf on the shelf. You can't see any grain in that. And so that it also relates back to that fiber content. So in breads like Ezekiel bread with those sprouted grains, it's still, processed in a sense that they still had to break it down a little bit to turn it into a loaf. But it's still going to be less processed than those other breads. So that's where it will come into the person in your body system too, and like we talked about those, for instance, those individuals with type 2 who may have insulin resistance so bad to a point where they're on insulin, they still may not tolerate something like Ezekiel bread so much as somebody who
Mhm.
may just have pre-diabetes would do just fine on it with that fiber content.
Got it.
Mhm.
I'm thinking of like this really good Italian restaurant that I've been to a couple times that just has this like dark brown, like warm, feels like it might be healthy and tastes healthy. Like, is there an ingredient? Like, is there something we should be looking out for? Or is it just like Ezekiel bread is pretty much all we got?
No, not necessarily, because I'm actually a fan of Dave's Killer Bread. I don't know if you had that one before, Dave's?
No.
Okay.
Oh,
Yeah,
yeah,
so
yeah, yeah.
Dave's okay, yeah, yeah, yeah. So Dave's Killer Bread also has a lot of sprouted grains in it. So really, if you're buying bread off the shelf, you want to read the label because a lot of our more processed breads will tend to the first ingredients that you'll see. It'll say whatever that flour is, or white flour or wheat flour, but it won't mention specifically grains. So you want to look for your bread to have grains. And so that's what makes Ezekiel Dave's Killer Bread so much better, because you actually see the grains that are listed there, and it's not just
Oh,
all flour. And then the other thing is sweeteners. So most breads will tend to have sweeteners in them. And I can't recall exactly if Ezekiel does or not, but I want to say Ezekiel maybe use raisins or dates if they do have some sweetener in theirs. But a lot of your more processed breads will tend to just have corn syrup or rice syrup, which is essentially just sugar. And so they're gonna, be not as healthful for you in terms of your blood sugar, because they also, they not only are you getting that processed carbohydrate from the flour, you're also getting it from just the sugar that they added to it too.
wow. Okay. Is Ezekiel bread vegan? Some of it or all of it?
Yeah, it is. I'm pretty much sure all of theirs are
All of them
vegan.
is? Okay.
Yeah, I don't think they add any eggs or milk or anything to theirs. And that's another thing to look out for too on the labels, with because even some breads they'll have milk added, or
Yeah.
eggs added to it. So, yeah.
Yeah, 100%. As we're closing up here, I'd love to kind of touch on inflammatory, how our bodies are kind of puffy,
Mhm.
inside and outside, and
Yeah.
how consuming less meat and more plants
Mhm.
um, can be helpful
Yeah.
around that inflammation.
Yeah, great question. Yeah. So in terms of inflammation, yeah, so what can cause inflammation within our body are fat, salt, sodium, those things can tend to cause more inflammation within our bodies. And so then that can translate into high blood pressure. It can translate into heart disease and increasing your risk of heart attacks and strokes by having those blood vessels not work as well for having blood flow through our body from those inflammatory processes, as well as conditions as joint conditions. So, people who may have arthritis or joint pains, those types of things, just based upon those the fat and those salt sodium intakes versus plants. Plants are auto natural anti-inflammatories, excuse me. So particularly your dark leafy greens, because even the pigment that naturally occurs in them they're called phytochemicals that make them that dark green color. But that pigment actually works as a natural anti-inflammatory in our body. So when we eat more plant foods, that actually helps to reduce the inflammation. So that helps. That's why it's also helpful for lowering our blood sugar, lowering our risk of heart disease, by having more plants in our diet that way, just because we're introducing more of those good pigments. There are some other foods too, plant-based foods. Beets are another one that I typically highly recommend for individuals. With inflammatory conditions, because they can actually be very helpful too with blood flow and with reducing inflammation, as well as cherries are another one that's been found to be helpful with that. And then some of the spices like turmeric has been found to be helpful too.
Very cool. How does one eat a beet? Like,
A
do I
number
boil
of
that?
ways. Yeah, there are a number of
I
ways you can
gotta
eat
do
it.
me a Google
So,
search.
yeah, yeah. So beets are one of those foods I find when I tell people that they should be eating beets, I either get people that look at me like, "Ugh, I'm not gonna eat that," or people are like, "Okay, I'll try it." So beets, they're a root vegetable,
They
and so
taste like a
because of
root.
that, right? That's what I was about to say. Because of that, they taste pretty, like
Pretty
fruity,
rooty.
if you will. Right? Exactly. So for some people, they just cannot stomach that taste. But if you buy them, you can just buy a whole beet and you can roast it. I've had roasted beets that were pretty tasty. You put some spices and roast it in the oven. You can also have them pickled. Some people, like pickled beets. And they're good on some salads. I've had them, certain like slaw type salads with some pickled beets. They are good that way. But another one of my favorite ways to have them is in a juice. Honestly, it makes it more palatable. You can take the whole beet, you can put it in a juicer. There are some products that are on the market that are just straight up beets that they've taken and dehydrated, dried them out, turned them into a powder. And that way you can add it to like your water bottle or add it in a smoothie or and still get your beets in that way if you're not able to just eat the beets.
Wow, okay,
Yeah.
cool. Yeah, I've
Mhm.
had them on my salad a few times, and I'm like, "Girl, I'm not eating that.
I know.
That is
It is definitely
nasty."
right. Yeah, yeah, they are not very
I
palatable
always I
without
always
some work.
try it. I always like,
Yeah,
maybe this one's different, but
right.
I don't know.
Yeah.
Um, I just not a fan. One of the
You're
things that I
not the
have
only one. Yeah, they're hard.
introduced, into my diet, which I had done a long time ago, but I kinda got out of the habit, was kale. I actually
Mhm,
found 2 amazing recipes with kale, and I've been
mhm.
having some big, big, awesome kale salads that I'm just so in like, I
Yeah.
crave it, which is
Oh,
cool.
that's great. Yeah, yeah. Because kale is actually one of those things, that are hard to do too
Yeah,
with a salad because it's hard to chew unless you soften it up. But massaging it, which I'm
yeah.
sure you know,
That's
yeah,
what I
to
do,
massage it.
yeah.
Yeah,
Yep,
to soften it. Yeah, yeah.
yep, and it is totally different massage because there's a couple times where I forgot,
Mhm.
and I just start
Yeah,
eating it. I'm like, "This is
right. And
different."
you feel like you'll never stop chewing.
Yes,
Yeah.
yes. Well, this has been so great, Dr. Shayla. I so appreciate you being here and sharing so much awesomeness with us. I know that you opened your clinic. How long ago was that? Was it a while ago?
Yeah, so I opened the clinic in 2019 and it was really just the part of me that just really wanted to give this more because I felt like, I could help my patients just so much more by offering this type of clinic setup. So it is a more concierge model. All of my patients, we have appointments that are 30 to 60 minutes in length where we sit and we chat, we get down to the root of what's going on. We make those plans. We, add that nutrition component. We talk about how to get movement in. We work on those mindset things together and really help to improve health conditions that way.
Beautiful. And where are you
Yeah.
located for those that are
I'm located in Chattanooga, Tennessee. So the brick and mortar clinic is in Chattanooga, but then I do offer virtual metabolic health coaching to anyone in the country. We do it, yeah, by way virtually. So yeah, happy to
awesome?
chat with
And
folks.
then anyone listening live who's interested in kind of learning more about you or following you on social media, where should they be going online to find some good
Yeah. So I'm on Facebook and Instagram under Essence of Health Wellness Clinic. So if you just look Essence of Health, you can find me Facebook and Instagram. Dr. Shayla on TikTok. And then my website is drshayla.com/EOH. And that will just have all the different links to about the programs that I have. I have a free Nourish and Flourish mini course where folks, if you are just not familiar with plant-based and not even sure where to get started, it's a free 5-day course that you can take and just get started to even just implement some things that way. But you can find it all at drshayla.com/EOH.
Awesome. Beautiful. To those of you that are listening live or on the replay, thank you so much for being here. If you resonated with Dr. Shayla and all the goodness that she shared, make sure to follow her. Her link that you see here, feel free to screenshot. You can also find it in a clickable link in the description wherever you are watching us at. Any closing thoughts as we kind of wrap up here?
Yeah, only thought I would tell to people, you don't have to be perfect. None of us are perfect in our health, but even just putting some more plants on your plate would be very helpful to you. So just put more plants on your plate, however that may look for you.
I love that. Sweet and simple.
Yeah.
Beautiful. Well, that brings us to an end of yet another incredible episode of Her Talk Show. Thank you, Dr. Shayla. Thank you
Thank you
for
for
those of
having me.
you listening live or on the replay all the way till the end. We appreciate you. Remember to follow, like, and share. Once again, I am your host, Sabrina Victoria. I invite you to join our amazing community, Her Nation, where we continue to uplift each other every step of the way.